Well, this year at the International Myeloma Society meeting, I had the pleasure to talk about immune profiling in the context of patients receiving cellular therapies, particularly CAR T cells. This is a fascinating era, an era that I think for the first time we are seeing how clinical research is moving faster than translational research, and we on the translational research are trying to speed up and match what our clinicians are achieving in terms of patient outcomes and drug approval. And this particularly applies to immune profiling, because finally we have specific immunotherapies that really work through the action of T cells redirected to different tumor antigens, and therefore more than ever a better understanding of the patient immune status, of how the patient immune status is associated with the efficacy of these agents, how to select patients, the best time point for these immunotherapies, the type of immunotherapy, now that we have so many different assets that work differently, CAR T cells, T cell engagers, and also the antigens that these cells are being reoriented, redirected. It is more important than ever. I must say that there is a growing body of data. Data is definitely suggesting that the patient immune status, patients with myeloma have an immune status that becomes dysfunctional very early on, probably even before malignant transformation, so from precursor conditions into active myeloma, and then it becomes even more dysfunctional at the time of relapse and after numerous lines of therapy. So I think that this really sets the stage and urges the clinical investigation of these therapies early on during the disease evolution, and also as biomarkers for patient selection to the optimal assets that would work better on these individual patients, and then understanding of response and resistance. To be fair, I also said at the meeting that while data is being generated and is promising, thus far the most exquisite markers that allow us to predict resistance to these cellular therapies are coming from the genetic patient characterization, particularly biallelic events in the genes BCMA and GPRC5D.